All right, everyone, I think we're ready to get started. Thank you so much for joining us. My name is Rebecca and this is Lauren.
Hi, everyone.
We are hosting this webinar, as you know, in conjunction with our monthly newsletter. So keep your eye out for those. They will have some up-to-date events and the next webinar schedule as well, so you can sign up for those through the newsletter. And you'll also be able to access the recording of the previous webinar through the newsletter. So keep your eyes out for those. I just wanted to remind you all that you will be on mute, but we can take some questions. So if you have any that pop up throughout the webinar, feel free to enter those in the Q&A box at the bottom of your screen.
All right, thanks, Rebecca. So today we really want to talk about diabetic retinopathy. We wanted to connect to the mission. Why are we doing these screenings? So I know it's really easy during the day-to-day. You're just, kind of doing these as part of the workflow, which is wonderful. But sometimes we forget about, the reason behind the exam. So we wanted to talk about what diabetic retinopathy is, what your patients experience when they're diagnosed with it, what it means to have diabetic retinopathy, how we can prevent it. And so we just wanted to connect really with the why behind doing this screening in the various settings that you're doing it in. At the end of the webinar, we'll also take a few moments just to discuss some tips for closing those care gaps. The end of the year is approaching, so we wanted to offer some suggestions on things that some of our clients have done throughout the years to close those gaps as we are nearing the end of 2022. Can't believe it's already almost the end of the year.
Neither can I.
Okay, so let's start off with talking about why we do this exam. So as you may know, diabetic retinopathy is the leading cause of blindness for working age adults in the United States. It is completely preventable. Diabetic retinopathy is preventable if it's identified early. So we've got currently about 30 million patients in the US who have diabetes. Less than 50% of those patients are taking that referral from their providers and going to an eye specialist or an optometrist to receive an annual diabetic retinal exam. So that's a huge gap of people who are not getting this on a regular basis and who are not finding out that they have eye disease that needs to be treated so that they can preserve their vision. So we've got about 3 million patients who are about to go blind from some form of diabetic retinopathy or other eye disease that they are unaware of.
That 3 million number is only increasing. So as you can see in these graphs here on the screen, from 2004 to 2019, the number of individuals with diabetes and thus the number with diabetic retinopathy is exponentially increasing. And if we had a map to show you of this year, I'm sure it would be even more dark blue than you can see in that map of 2019. So like Lauren said, that gap is just growing, and this isn't going anywhere anytime soon. We need to help the patients get access to this screening in order to preserve their vision at the best that we can.
Absolutely.
So what exactly is diabetic retinopathy? So, that's what we're looking for, but what does that mean? Here on the screen, you can see an illustration on the left, an eye with no pathology, and then on the right, an eye with diabetic retinopathy. So diabetic retinopathy is a fancy way of saying the high blood sugar from someone with diabetes is affecting the vessels in the back of their eye in the retina, and the blood is leaking out of those vessels and pooling around them, and that blood is blocking the light from being detected by the retina. So that's essentially what is happening on the inside of the eye.
And here we have an example of actual retinas that are being affected by diabetic retinopathy. So on the left, again, we have a healthy retina with no pathology. Those blood vessels are intact. On the right-hand side, we have a retina that is currently at the stage of severe diabetic retinopathy. Those blood vessels have already experienced quite a bit of damage, and left untreated, that blood will just continue to pool and that retinopathy will get worse and worse. So as you can see, in this example, the diabetic retinopathy, it just continues to progress, and it can really start to affect that vision as it gets further on down the line.
So if you ever wondered what it looks like for your patients who do have diabetic retinopathy and what it looks like as it progresses, this picture gives you a good illustration of what someone might see. So those dark spots or strings floating in their vision, black or empty areas, vision loss, fluctuating vision, blurry vision, all of these things can be caused by diabetic retinopathy. And of course, it just keeps getting worse the longer it's left untreated.
So we actually have an example here of a retina where diabetic retinopathy has been left untreated. As you can see, the blood has continued to pool, and this person's vision is being significantly affected, and they will go blind if they don't receive treatment. So if you were wondering what it would look like to go completely blind from diabetic retinopathy, what you could do is if you close your eyes, and then you cover your eyes with your palms. That is what a patient who goes blind from diabetic retinopathy would experience. So they won't see shadows, they won't see shapes, they won't see light. The vision loss is complete if they do not receive treatment. The good news is, if they receive treatment, if they find and identify diabetic retinopathy at an earlier stage, it is very easily treated. If your patients identify mild diabetic retinopathy, simple changes in diet and managing their sugar better would really go a long way in preventing the progression of that. So diabetic retinopathy is completely manageable. The key is early detection so that we can prevent the progression of the disease. And that's where you all come in. By providing these screenings to your patient, by helping them identify these conditions in earlier stages, we are helping them get a handle on that before it progresses to this stage. So the earlier that we detect these, the better.
So many of you probably have heard the term iris sight save. So this is terminology we use to identify a group of findings that you might see in some of your results. So here on the screen, you can see what makes up an iris sight save, or what pathologies would qualify as an iris sight save. We have moderate, severe, or proliferative diabetic retinopathy, macular edema, epiretinal membrane, glaucoma, a macular hole, or wet age-related macular degeneration. So those are the pathologies that make up an iris sight save. These are findings that need treatment immediately. So without treatment, these will be immediately sight threatening, which is why we call it a sight save if we've identified one of those. So up until this point in time, we have done almost 142,000, identified 142,000 iris sight saves. So that is really exciting, all due to your efforts. So thank you, and your patients also thank you for that as well.
Absolutely.
So many of you probably have a story about how this exam impacts patients in your clinic or your setting every day. I know I have seen it firsthand. I remember a time I was in Tennessee training a clinic, and we had a patient come in who had not been able to get an eye exam in over 2 years. because she didn't have anyone at home to drive her to and from an appointment at an ophthalmologist after being dilated. Her husband had recently passed away, and after that, she didn't have anyone to provide that transportation. So she was extremely grateful and relieved to be able to get this screening in her clinic. So I know, Lauren, you've had similar experiences. Do you have a story you want to share?
I do. So earlier this year, I was also conducting a training. I was in Michigan, and we were seeing patients that afternoon. And there was a gentleman who was 30 years old who was eligible for the screening. He had never had a diabetic retinal exam before. And so we let him know that he was in need of one. I will say he was reluctant to receive it, but we told him it would only take a few moments. We were just going to take a few pictures of his eyes. And thankfully he agreed. His results came back with bilateral diabetic retinopathy, moderate diabetic retinopathy, as well as positive for macular edema. So he had those conditions in both of his eyes, and he had no idea. And he was not someone that you would look at and think that he was losing his vision, but he was in the process of losing his vision. And I'm so grateful that he agreed to get the exam, and we were able to provide those findings to him, because he was going to be able to get that referral and get the treatment he needs.
That's great.
I have to say, when we hear about these stories or when we experience them, it really connects us to this mission and makes us realize, once again, how important this is and the impact that we're making on people's lives every single day. So again, thank you so much for all that you do to help your patients identify these diseases and get the treatment that they need.
I agree. If any of you have a story you want to share, there is a link in our newsletters that allow you to share those stories. So be on the lookout for that. Feel free to send in any stories you have. We love to hear them. It gets us excited as well. So
definitely
feel free to send those in.
Yes. All right. So the last thing we wanted to kind of talk about, and just as a reminder, we are taking questions throughout the webinar in that Q&A box. But we wanted to talk a little bit about gap closure. So it is the end of the year. We are trying to make sure that all of our patients have received all of the services that they need to for the year. And as some of you may already know, November is Diabetes Awareness Month. So you can leverage Diabetes Awareness Month to get those gap closures completed for your patients who have diabetes and who are in need of those services before the end of the year. So a couple of things that you can do. One of the suggestions that we have that some of our clients have used in the past is having a screening event dedicated specifically for services that your patients are in need of. You could have a screening event just for the diabetic retinal screening. You could have an event that includes the diabetic retinal screening and other services that your patients are in need of. And you can schedule that on a Saturday, 8 to 12, have them come in and receive those services so that you can get those gaps closed and get your patients the care that they need.
Yeah, that's a great idea. And we've had several organizations do something similar. Another idea that people use is to utilize those nurse schedules. So you can schedule nurse visits if you have enough staff in your clinic and get as many people on that schedule as you can for the day and just knock out all of those retinal screenings in one day. So that's another idea.
Absolutely. You could even schedule a comprehensive diabetic preventative care visit where you would complete not just the diabetic retinal screening, but also the foot exams and take their A1C and close, multiple care gaps simultaneously.
Don't forget, you can also use those patient outreach tools available to you. So for instance, your patient portal or any phone or text messaging tools you have, as well as good old-fashioned snail mail. That works well for some people also.
Definitely. And we have patient education material. You can always reach out to us if you're in need of an FAQ or a brochure or posters that you want to display in your waiting room or in the exam room. So don't forget to use us as a resource to get a hold of some of those materials, particularly if you're looking to mail something out or hand something out in the office. Speaking of materials that you can get from Iris, we also created these handy dandy buttons. So as many of you probably already know and may already use in your settings, buttons are a great way to get conversations started with your patient. So our button says, have you had your diabetic eye exam? And so if you're wearing this button and a patient sees it and they say, oh, I'm a diabetic, I have not had my diabetic eye exam, that can get that conversation started. So we have these buttons available in various colors for your use. So if anyone is interested in getting some buttons for your location, please feel free to let us know in that Q&A box, or you can send us an email. You can contact support at any time for patient education materials or buttons so that you can make use of those.
All right, so get those questions in. We are ready to start answering some of those. We did get a question a little bit earlier about when the patient has already lost their sight due to diabetic retinopathy, is there any treatment to regain their sight? So unfortunately, if it does progress long enough, there's not a lot that can be done to totally regain their sight. So early detection is the key, which is why you all are doing this exam in your setting, because it is typically earlier in the process than a patient would normally go to their ophthalmologist if they're not already complying with those annual referrals. So definitely want to get those done as early as possible in order to treat that diabetic retinopathy.
Right. I do see we've got some requests for buttons and educational material. Thank you so much for sending those in. And we will be following up with you after the webinar to make sure all of you get the things that you've requested. So feel free to drop any more requests in that Q&A or send us some more questions about diabetic retinopathy or anything that we've covered today, or any questions that you have, anything that's come up in recent screenings that you've conducted. We are here to help.
All right, well, I don't see any other questions. We'll give it just one more minute if anyone's typing those out before we wrap up. Okay, so we got a couple of questions here about treatment. What treatments are there for diabetic retinopathy other than glucose control and diet? So there are treatments that an ophthalmologist or retina specialist can do to mitigate that retinopathy. So things like injections and laser treatment would be done by an ophthalmologist. So that's what you're looking for. Does this person need to be seen immediately in order to receive a treatment like that?
Yeah. We have another question regarding any symptoms that your patients with diabetes should look out for. For example, is diabetic retinopathy painful? So one of the things that's really challenging about diabetic retinopathy is people frequently do not notice any signs of diabetic retinopathy in its early stages. So earlier forms of diabetic retinopathy, you're not going to see any symptoms in terms of vision loss. Those symptoms that Rebecca mentioned earlier are typically what's happening at later stages of the disease. So many, if not all of your patients won't really notice any changes to their vision if they have mild diabetic retinopathy or even moderate diabetic retinopathy. So that's one of the reasons that we really emphasize the need and the importance of having this screening done on an annual basis, because we really want to make sure that we are regularly checking to see if diabetes is affecting the health of your patient's eyes, because frequently by the time they see symptoms, they have progressed to a later stage of the disease and they need treatment immediately.
We also got a question, do pre-diabetics need retinal scans? So that would be a clinical question for your organization to answer. I will say typically the payers don't cover it for anyone who is not already diagnosed with diabetes, but that would be something for you to decide in your organization.
Absolutely. All right, any other questions? Well, again, I do want to make sure that we highlight the importance of your role in helping end preventable blindness. That is our mission here at IRIS. We are trying to end preventable blindness, and there is absolutely no way we could do that without all of you, your dedication to this program, your dedication to your patients. You are making a difference in their lives, and we hope you know how appreciative we are of that.
Yes, thank you so much. Thank you all for joining us. And we hope to see you on the next webinar.
Have a wonderful day, everyone.